I mean, where do we begin, right, when it comes to Helen Joseph? It's just one hospital in Gauteng. We know that there are a number of hospitals in the province that face very similar issues. But let's hone in on Helen Joseph and talk about perhaps the 30% vacancy rate in nursing staff at Helen Joseph and how that impacts the people who now have to shoulder a lot more of the burden.
Let me start by saying greetings to you and viewers. And as DENOSA in Gauteng, we welcome the report from the Ombuds and quite clearly on what issues that we have tabled. And with that report, we want to see that we applaud the nurses on the strains that we would have experienced because of these measures that we put against them by these processes. So, but as you have mentioned on the issue of vacancy rate, I think it is quite clear that the Department of Health currently it is undergoing tremendous challenges, and which raises concern to ourselves as the DENOSA, because you note that for almost 6 months now, Department of Health they have not been appointing nurses for that matter, and they've been imposed the austerity measures for not appointing for reasons that we don't know. Because currently, the fact of the matter is that we're having people who have retired, we're having people who have left services, they went to other countries or other private sectors. And for that matter, the Department of Health is failing to fill those posts to date, which is a concern to us because of the work that was supposed to be done by those that would have left the services. It is done by those who are remaining in the system, and it puts a strain on them. And at the end of the day, it's the nurses who are supposed to carry that burden, carrying the department shortfalls or the failures into ensuring that the Department of Health gets to be make sure that the posts are filled and the services are rendered of quality as supposed to.
Yeah, absolutely. And, you know, we can't fault nurses for looking for better opportunities elsewhere. But there are a number of people that stay in the position because they want to make a difference. Nurses, doctors, medical personnel across the board.
Yes, I agree with you. But the sad reality is that the department also they have a role to play to ensure that those who are remaining there are operating or working in an environment that is conducive. But what we are seeing here is the video that was shared by Tom. You'd find that there are many patients in the ward with less staff, and we expect those staff to render quality services. Yes, we can't fault the nurses when they go for better opportunities, but what we are faulting is a department that is failing to fill the post of nurses who are leaving the services. And as we head now is 30%. And I can tell you now that we are going for a worse situation because at this juncture, they are not filling the post. And then they've implemented austerity measures to say that there's a moratorium and no post must be filled. And there's no exact date on when are we going to uplift this moratorium from the department. And for that matter, we have seen also other community service nurse practitioners being put on the contract instead of permanent post, which tells us now to say that the department is not ready to fill these vacancies. And as a result, these vacancies are going to be worse because of austerity measures that are put in place by the Treasury, including other healthcare workers, which are your doctors, your radiologists, your physios, and so on. So what we are saying is that it can be correct that the department find themselves being in a moratorium where we are dealing with the right of society, which is the health of theirs. And then when they come to institution, we can't return them, but they must access health at all given times. But the reality it is that we can't meet the demand that we are being faced with due to the fact that there's a shortage of staff within the institution. And that 30%, just give it some time, is going to rise.
Yeah. If you've spent a night in hospital ever, you will know just how integral nursing staff is to your care, right? The nurses are really the ones that are taking care of patients in hospitals. The doctors do their rounds, yes, and of course they do incredibly important work. But when it comes to an actual stay in hospital, it really is the nurses we depend on. So two things then, Bongani. What's leading to this level of low morale among nursing staff? It must surely be, on the one hand, that they are made to bear such a massive burden as a result of staff shortages. They're trying to do the best they can with very little or not enough resources. And there isn't stable leadership at Helen Joseph. There's been someone in the acting position of CEO since 2019.
Yes, and you'd know that where there's no proper governance, or leadership, we won't expect operation to be harmonious or peaceful. And that is a concern that we've been raising because we can't be having the assistant nursing service managers acting into a nursing service manager post 2 months and then interchangeably in that post, whereby you find that the one who's acting is supposed to take the duties of an acting, at the same time he must execute her or his duties of the post that is being appointed for. But now the challenge is that if then you don't find them being appointed in that post, specifically of the nursing service manager, then there won't be the direction and the governance will be lacking, which affects those on the ground. Secondly, is the issue of the nurses who are on the ground, that they find themselves with this shortage affecting them, and then they are exhausted, they have burnouts, and they are not being supported by the management because there are no debriefing sessions that are offered by the department, and there is nothing that the department is doing. For instance, the overtime of agencies, it is not paid because of these austerity measures that are being put in place on this post and the vacancies that we have. So now you can't expect now people to operate or to execute their duties in an environment that is not favorable for them, and they're expected to render quality service because of the society or the community. When they come, the people that they see is those who are working there, which are workers, but the experiences that they are being put in under or they're subjected to, no one gets to see those, and it's the department that needs to take account in that. And we're quite happy that it raised also the issue of infrastructures. It raised other issues which are making these nurses finding difficult to execute their duties at the workplace, because most of the buildings within the department, if you can take them through an OHS standard compliance processes, they don't even meet those standards. And then now you expect the very same nurses to execute their duties in those type of infrastructures. You expect nurses to execute their duties on the environment that is being strenuous and stressful for them, and at the end of the day, you expect them to render quality to the society. So we are quite comfortable that the Ombudsman has exposed the department on what they are doing to these employees who are being employed within the Department of Health, especially the nursing personnel. And for that matter, the recent one being the one of the mortuary, not the recent, but the video talking about the mortuary, expectation was that a nurse was supposed to push a corpse to a mortuary. It can't be correct, that thing, because it's not a duty of a nurse to do that. When is the nurse going to do their duty if they are expected to do non-nursing duties? So that's why we're finding ourselves here. And as the DENOSA, we are calling against nurses into executing non-nursing duties to cover the department failures and the departmental shortfalls. Because at this juncture, we are tired and we are saying that enough is enough, and we can't be found to be doing what we're not supposed to do, because at the end of the day, when the nurses are exhausted and are burnout, there's no one who comes for them. And when they do the mistake, are litigated, and they get to lose their jobs, and they even reported at their nursing council, which is sunk for that matter.
Yeah, absolutely. The true test is always whether our leaders will go to the hospitals that they so often defend, right? Bongani Banda, let me thank you for your time this afternoon. He is DENOSA's Gauteng chairperson as we reflect on the findings by the Health Ombud and the Health Standards Compliance Office into conditions at Helen Joseph Hospital.